Hello, dear aspirants. Welcome you all to the Master Nursing classes. Myself, Mr. Nagraj, your Norcet mentor and guide, here in front of you all today to discuss the one more beautiful, fruitful, a very important session for the Let's Crack Norcet students. As all of you know, that we are discussing the very important questions with a clear rationale and the concept. So today's in this session, I am discussing the questions that is related to the kidney transplantation, and the questions are related to our renal biopsy and the treatment of the chronic and acute kidney failures. We are discussing, as in the last classes we are discussed the very important session related to the dialysis, how the dialysis actually works, what are the principles, what is the osmosis, what is the diffusion, what is the ultrafiltration, how it actually works, and what is the pre-medications we need to tell, what are the medications we need to avoid before the going to the dialysis, what are the schedule, how we will do the peritoneal dialysis, each and everything we have discussed in detail in the last previous class. In the today's class I am focusing that is related to the definitive management of the chronic kidney disease or the chronic renal failure, or the management of the polycystic kidney disease, where the management, the definitive management, the final management of, yes, the kidney transplantation. In this today's session we will discuss those very important points that is related to the donor, that is related to the recipient, and the very importantly, what all are the things we need to prepare before going to the transplantation, what all are the nursing officers' responsibilities, and what all are the situation based questions, what all are the skillful questions we will discuss in the today's session very easily, very understandable manner in the easy English explanation. Okay, so the today's questions are somewhat tricky. Okay, the questions need the solid concept. I am trying to build a concept for the each and every questions. So be connected with the until the last questions. If you have any small doubt, please do comment in the comment box. I am trying to solving your doubt in the live session only. If you are unable to attend the live session, you are watching the video afterwards also, you can comment in the comment box. Okay, I will try to explain what all are the doubts you are having. So don't keep any minor to minor doubt. Try to solve the doubts before your main exams. Okay, so the we will start the questions sessions today. So if you are anyone is the new to my YouTube channel, so do subscribe to the channel and press the like button, where I am getting the motivation from that, so I can put the more and more important questions, I can explain the more and more thing for you for your Narcet exams. Okay, so here is the first question of the day. Yes, the read the question carefully, completely, and try to answer for the question. Very important question. The five-star questions I have brought in the first question only today. So yes, try to answer for the question. I'm trying. I'm watching your answers in the comment box, please. Yes, the 26-year Raman undergone the renal biopsy. Which of the following position to be given during the procedure? What happening here? So one patient is there. His age is 26 year. Okay, and he is undergoing the renal biopsy. Okay, so as a nursing officer. Okay, as a nursing officer, what is the procedure you will give to the patient, that is during the procedure. Okay, during the procedure, not after the procedure. Okay, so I want to answer in the comment box. So who all are knowing the answer, please do comment in the comment box fast. Okay, yes, students, keep the thing, the questions, these questions will come in the two forms. Whether the examiner may ask this one, the position that is given during the procedure means your answer is the prone position. Okay, so who all are given option C as a correct answer, your answer is the 100% correct. And who all are giving the left lateral position, do ask the explanation. So the left lateral position we will not give even after the procedure also. The left lateral position we will not give during the procedure also. Yes, we will avoid the left lateral position. Why? Because the position, it is not useful where our what we call the incision blade, it will not set over the skin in the 90 degree. So because of that, the surgeon will get very difficult if we give the left lateral position. So the ideal position that is given during the procedure is the prone position. And the very important question arises like this: the procedure that is given post procedure or the after the procedure of the renal biopsy, what is the position you will give after the renal biopsy? Means your answer should be a supine position. Okay, with rolled pillow rolled pillow, or else you can mention the rolled, yes, the cloth under the our biopsy site. Why we need to keep this one means the purpose of giving the supine position with the rolled cloth or pillow under the our incision site is to maintain the compression and is to maintain the pressure over the site of incision in order to prevent the bleeding. Okay, hope the concept is clear. If the examiner is asking the during procedure, your answer should be prompt. Why? Because the surgeon or the nephrologist who are taking the renal biopsy, he will get the easy access. Okay, and as all of you know, the kidney is present retroperitoneally, that is behind the peritoneal membrane. So if you are giving the, yes, the prone position means we can easily access the retroperitoneal organs. So, because of that, the prone position is very ideal for the renal biopsy. Hope the concept is very, very clear. Okay. And very, very importantly, keep in your mind the position that is given during the procedure of taking the biopsy from the our renal bladder is the lithotomy position. The ideal position during the our uh, bladder biopsy is the lithotomy, and if you are taking the what we call the biopsy from the kidney, that is the prone position. So the answer for this question goes to the option C, that is the prone position. And if the examiner asking after the procedure, that is the supine, during the procedure, that is the prone. Hope the concept is very clear. Here is the next question in front of you all. Read the question carefully and try to answer for the question. Yes, the question is like this. Which of the following is most desired type of the donor for the kidney transplantation? So, what is the examiner asking? The most desired type of the donor. Students, yes, all of you know that if somebody's kidney is failure to function more than the 3 months, okay, so we call that as the chronic renal failure or the chronic kidney disease. If somebody's kidneys corticomedullary differentiation is get lost, means we are unable to differentiate which one is the cortex, which one is the medulla. So at that point also we will need to transplant the kidney, and the kidney is unable to excrete out the metabolic waste. So because of that, the waste which are generating in the body are damaging our vital organs like brain, heart, and the liver. So because of that, so the vital organs are getting damaged, means the life is about to end. Very importantly, in the situations where the kidney unable to excrete the waste, so temporarily we will manage that condition on the dialysis, but the definitive treatment again comes to the renal transplantation. Okay, so the situations I have explained, so the where we will need to do the renal transplantation, because the renal transplantation is the definitive management of our chronic renal failure. So in polycystic kidney diseases also, where the kidney is having the multiple cyst over it, so it's in very painful conditions where you unable to feel that pain, the pain where the all at that intensity where we will break the body's bone all together. So that kind of the pain at the flank region patient will experience, whether we have seen this patient in the clinical area. So it's an unexpressible pain, the very dangerous pain we will the patient will feel due to the polycystic kidney disease. So again, the treatment of choice for the polycystic kidney disease is renal transplantation. So who will give the kidney? Whether we can prescribe, yes, one kidney from this medical shop. If the patient is going and asking whether they will give the kidney there, no students. We required the, yes, the perfect donor from whom we are taking the kidney. Them we call the donor, and to whom we are implanting the kidney, then we call the recipient. Who is receiving the kidney is the recipient, and who is giving the kidney is the donor. Whether we can take the kidney from all? No, we can't take the kidney from all. So where we are need to do the certain histocompatibility test. After matching with the histocompatibility test, so we will decide whether the kidney should be taken or not. Okay, the best, the most desired type of the donor where the highest chance of the matching of the, yes, the all histocompatibility test is the our own family pedigree members. The one family pedigree member starts with the mother, father, and the identical brothers, identical twins, and the sister. Students keep in remember that If the person is married, the wife is also comes under the family pedigree. But remember, the wife is not an what we call the desired donor. We will not consider wife as a desired donor. So wife is an our least priority while taking the yes the what we call the kidney from the donor. Okay, keep in your mind. Even though she comes in the family pedigree, even though the wife is a part of the family pedigree, we will not consider wife as an yes the desirable donor for the kidney transplantation. Why? Because her genetics is different, her histocompatibility is matching abilities are different because she came from the other family. Okay, so consider this one. And the examiner is asking the most desired type of the donor is the always the living donor. Okay, and from the living donor, who is the most desired? Yes, he is the family member. From family member, who is the most desired? Yes, he is the identical twins. Okay, okay. If there is no any identical twins option in the family, identical twins option in the yes, our given options, you can go for the answer for as a brother also. Okay, or a sister also. The best is always brother. Okay, keep in your mind. So the best is always brother, and the donor who is living donor is always yes the very important one. Okay, so you are taking the kidney from the living donor and you are implanting in the recipient means the urine output will start within an hour. Okay, so if you are taking the kidney from the cadaveric donor, yes, from the cadaveric donor in the sense what, we are taking the kidney from the dead person. No, 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 students, we are taking the kidney from the person who is in the deep coma, and the person whose brain is about to death, and the doctor declared that the brain death or the patient is in the deep coma where his chance of arrival and awake is very less. So at that situation, if the donor given the sign over the consent, or the we as a nephrologist or as a nursing officers, we need to counsel the family members to take the kidney from the cadaveric donor. The cadaveric donor not stands for the taking the kidney from the dead body. It stands, we are taking the kidney from the yes, from the person whose brain is dead. So that is we, so to whom we call as a cadaveric donor. Okay, so here in cadaveric donor, very very importantly, so the person should give the consent for the organ donation. Okay, so that is the very very important. If the person is in the deep coma, we can take the consent from them as the family member. Very very important. And so the option C is the non-heartbeat donor. Non-heartbeat donor means the cardiac death is happen. Okay, the cardiac death is happen. This is also type of the donor where the situation arises where in this condition we need to harvest the organ immediately. In the living donor also we are having the sufficient time to take out the organ from the body to donate to implant in the other person. And in the cadaveric donor also we are having the sufficient time to take the yes organ, harvest the organ and implant in the others. So in the heartbeat donor, we need to take the yes the vital organs within 4 hours. Okay, so within 4 hours of the cardiac death. Why? Because if the heart is unable to pump, if the heart is unable to pump, the perfusion for kidney is also not there. If it is more than 4 hours, the perfusion is not there means the kidney is going to die permanently. So the situation where there is and the immediate harvesting the organ arises is the only in the non heartbeat donor. Keep in your mind. Okay, so very very importantly. And so from animals we will never ever take the kidney, never ever take the kidney to implant in the person. Okay, so the answer for this question is a very very importantly, that is the most desirable donor is the living donor. Who all are given the option A as the correct answer, your answer is very very best. And the question arises like this also, the situation where in this condition the immediate harvesting of the yes immediate harvesting of the organ is required, that is our non-heartbeat donor. And from whom we are taking the organ, so the person who is having the brain death, so to whom we call as a cadaveric donor. Okay, hope very very importantly you all got the definition and the clear concept to whom we need to take the organs. So very very importantly the questions will come in the exam like this only. Okay, so all possible questions with the beautiful rationale I have explained for the permanent remembering for you. Okay, so which of the following test need to perform to check the histocompatibility in kidney transplantation. Okay, so what happens, students? So when we take the organ from this someone, when we take the organ from this someone, okay, and we are implanting inside the person body, consider this one as a person body, and this is the organ we are implanting inside the person body. So if it is histocompatibility not matching, means this organ may, yes, the damages the person body. Okay, if this organ may damages the person body, so these situations we call as an graft versus host reaction. What is the graft versus host reaction? The implanted organ only which is damaging the person's body. Look at the directions. Direction is like this. Yes, the organ only damaging the person body. So that is versus what we call the graft versus host reaction. In the situation, consider this one as a body and this is the implanted organ. Our body is forming autoantibodies and which is damaging the, yes, our what we call the organs. So look at the arrow marks here. Our body only is rejecting the, our body only rejecting the organ. We call that one as in the graft rejection. Students, very very importantly, keep in your mind what is the graft rejection. Graft rejection is a condition where our body is rejecting the, yes, the implanted organ. That is the graft rejection. Where the graft versus host reaction, the implanted graft, what we call the graft only which is damaging the surrounding tissues. So we call that as a graft versus host reaction. So because of that, in order to prevent these two situations, graft versus host reaction and our what we call the graft rejection, we need to check, yes, the histocompatibility test before doing the, yes, kidney transplantation. If histocompatibility matching only, we will take the organs. Means it's not a joke to take the organ from the somebody, and it's not a joke to waste the organ of the someone, because the organ generates in the intrauterine lab once life. Okay, so the organs, so it will not develop again. That is our kidney. So only one time it generates. Very very importantly, we need to be super cautious here before taking the our kidney, because if it is histocompatibility not matching, means we are wasting one organ, means one life we are wasting. Students, keep in your mind. So because of that, to prevent that one, histocompatibility test is very very important. So first we will check the, yes, the their ABO, means their blood group is matching or not. Okay, and the antigens, whether there is any autoantibodies may forms against this ABO. So we will check first. Okay, that is the ABO histocompatibility, and we will check for the HLA matching also. What is HLA matching? HLA matching is the human leukocytic antigen matching. Very very important, students. We are having the six type of the HLA. That is HLA A, HLA B, HLA C, HLA DP, okay, HLA DQ, and HLA, so sorry, HLA B, C, D, P, Q, and R. Okay, HLA. So we are having the six type of the HLA antigen. So in case 6 out of 6 matching, means we call that is and the as the perfect donor. We call that is in the perfect donor. Okay, 5 out of 6 or the 4 out of 6 matching, means we call them as a good donor. Okay, in the situation where the 3 out of 6 is matching, means we call that is the minimum donor, minimum matching, or the minimum matching donor. Okay, if in case only 2 out of 6 or the 1 out of 6 or the 0 out of 6, means this is whom we call as in the bad donor. Okay, if we are taking the, yes, the kidney from the minimum matching donor and the bad donor, we need to, yes, we need to prepare the patient in such a way that his entire immunity is compromised to prevent the graft rejection before transplantation only. So that is what we call the induction of kidney transplantation. What is the induction of the kidney transplantation? Induction in the kidney transplantation means we will give the steroids, we will give the, yes, the monoclonal antibodies to keep the person's immunity at the low and low. So if the person's immunity is low, means the rejection of the graft is also, yes, there is less chance of rejection of the graft is there. So because of that, we need to give the kidney transplantation induction before transplanting the kidney. Okay, HLA matching also we are doing. So if in case of the perfect matching and the good matching, no need of the induction. So only in the bad matching and minimum matching we need the induction, where we are giving the steroids and the monoclonal antibodies Okay, in order to compromise their autoantibodies and the immunity of the person. Very, very importantly, that is before doing the renal transplantation, we call that one as in the induction. Okay, induction of the kidney transplantation, induction for the kidney transplantation. Hope the concept is very, very clear. Okay, so and one more thing, that is our tissue specific antigen, that is the TSA, also need to assess. Why? Because tissue specific antigen is a antigen where it is very specific to tissue. So which tissue we are implanting, so any antigen which is present inside the recipient body we need to assess. Why? Because if the antigen which is present specifically towards the, yes, the donor's kidney, means we will not implant, we will take the kidney from the another person. Why? Because this tissue specific antigen, if we are implanting like this only without checking, means it will damage the, yes, the kidney which we are implanted inside the body. So again it is waste of the money, waste of the time, and the waste of the one organ of the another person. That is not a joke. Okay, so we need to check the tissue specific antigen also. These are the very, very important, yes, the histocompatibility test we need to do before doing the kidney transplantation. Okay, that is the ABO compatibility, HLA matching, and the tissue specific antigen. Okay, so the all answer for this question goes to the, yes, the, that is the all the above is the correct answer for this question. So these are the, yes, the histocompatibility test we need to do. So the now question arises in the situation where there is no need of the doing, yes, the HLA matching. So we are having the three situation students. So where there is no need of the doing the HLA matching, that is the human leukocytic antigen matching. If it is no need to do, that is the our HCl, hydrochloric acid. No, HCl means, yes, the very, very importantly keep in your mind. So while implanting the cornea, while implanting the liver, and H stands for while implanting the heart. Very, very important. So for heart transplantation, no need of the HLA matching, and for the cornea transplantation, okay, no need of the HLA matching, and for the liver transplantation, no need of the HLA matching. Okay, so keep in your mind HCl, hydrochloric acid, where there is no need of our human leukocytic antigen matching. Okay, keep in your mind. Very, very important. So one more questions which arises in your exam. So only transplantable part of the eye is the only cornea, cornea, cornea. So eye transplantation, eye donation camp, so eye harvesting camps. So whatever you have heard in your minds. So I, in the sense, we will not take entire eye students. Only the, yes, the anterior part, that is the black color anterior part. Only the part we can harvest and we can implant in the another person. The only implantable part of the eye is the only is the cornea. So we are unable to implant the our what we call the sclera, retina, and choroid layers. We are unable to implant that one. So we, if we are implanting also, that is not going to be useful. Only the, yes, the implantable part of the eye is the cornea. Keep in your mind, very, very important. Okay, so hope the concept is very, very important. Here is the next question for you. Read the question carefully, completely, and try to answer for the question. Yes, the question is like this. Read the question carefully, completely, and try to answer for the question in the comment box. Yes, the following is the true about donor in kidney transplantation includes all except. Yes, the following is the true about the donor in the kidney transplantation. So that is includes all except one. So option A is like this. So the option A is the donor should be free from all systemic infections. Yes, it is very mandatory. The donor should be free from the all systemic infections. Especially the donor should not have the any positive viral markers. Especially he should be free from the, yes, the HIV. He should be free from the hepatitis B, hepatitis C. Okay, and all kind of the, yes, the systemic infections. He should be free. Okay, and most importantly, he should not have the impairment of the another kidney. Means from the donor we are taking the right kidney, means his left kidney should be very normal and very functionally active. Okay, so if there is any impairment, okay, if there is any problem with his left kidney, we won't take the his right kidney. Very, very importantly, because for us the recipient's life is equally important as in the importance of the donor life. Okay, so it's very important. His both should kidney should be functionally active and functionally normal. Okay, and the person should not have the any active tumors or any active cancer cells inside the body, and the person should be free from the infections. Okay, and the donors both kidneys should be work normally. That is the option B is also very correct, and it is also very true. Yes. And option C is the right kidney are prepared to be taken from the donor. So I will talk on this one. This is the wrong statement where we will consider as an except for this one. Okay, and option D is the yes, the donor should be most emotionally stable. Yes, he should be emotionally stable. Sometimes for a child, his own mother will give the kidney, and for sometimes for mother, his own child should will give the kidney. So family emotions may arise inside of the patients while giving someone vital important organs to others. So the person should be considered well. So the person should be psycho actively and psycho behaviorally very normal, and he should be emotionally stable before giving his yes the kidney. So option C. So that is what I told the wrong statement. I will talk on this one. Okay. So it's a the question is saying okay. The question is saying the right kidney is prepared to be taken from the donor. No students will prepared for the yes right kidney also we will take, but we will not prepare. Why? Because we will prepare the left kidney. So here is the rationale for that one. Okay, read the question. Listen the rationale carefully. Where you will get the yes the exact knowledge about why we will prepare the left kidney. Students, yes, all of you know that our right kidney is situated yes in the right side, okay, and the left kidney is situated left side. Very basic, all of you know that one. Okay, and the left kidney is situated somewhat above, okay, and left kidney is situated somewhat laterally, and the left kidney right kidney is situated yes somewhat low as compared to the left kidney. Why? Because just above the right kidney there is liver, so the liver compresses the right kidney, and it is somewhat lower, and it is somewhat medial side. Okay, so here it is the middle side, you consider this one. Okay, so here it is our exact midpoint of our body, so the kidney is towards median and its lower side, and the left kidney is towards somewhat lateral. Okay, look at this distance. This is the dismal distance, only this is the dismal distance. Okay, right kidney is somewhat medial and it is lower situated, and the left kidney which is somewhat lateral and which is situated higher. So students, the concept is not this one, the concept is here. Okay, so look at the explanation now. So let me erase this one first. Okay, yes, here is the rationale. When you all know that one very big vein goes like this in our body as an inferior vena cava, which takes the blood from all the our organs, tissues, muscles, cells, which artery have supplied, it will take back the blood to the heart. So that is our inferior vena cava, that is situation towards the our right kidney. And the aorta, the aorta which will directly comes from okay, let me take the pen color. The aorta, which comes from our very important what we call the heart. So that is towards our left kidney. Okay, that is towards our left. So the vein length for the right kidney is very short, and the vein length for the left kidney is very long, and the arterial length for the yes our right kidney is very short, and the sorry very long, and the arterial supply for the our left kidney is very short. Why? Because the aorta is situated left kidney towards, and the inferior vena cava situated our very importantly right kidney side. Okay, so for kidney transplantation ideally we need the long vein. So in order to connect that vein to the implanted person's vena cava, so we need the long vein. So because of that we will always prefer for the left kidney as a preferred kidney. We will take from the donor, not right kidney. Right kidney also we will take, but the preferred one is the left kidney, because it is having the long vein. We can connect this kidney in the recipient body very easily. So because of that we will always prepare for the left kidney, not for the right kidney. Very importantly, one more questions I will tell. So in the male we are having the yes androgen producing glands, there is the testosterone. So the testis. So the testis which is towards right side, it will drains into the our very important directly into the inferior vena cava, and the left testis it will drain into the our, yes, the renal vein. From the renal vein into the, it will go into the inferior vena cava. So very importantly, the, yes, the right testis which it will drain into the direct into the inferior vena cava, and the left testis it will drain into the renal vein. Hope the concept is clear. Okay, so because of that option C is wrong here. So why? Because it is telling right kidney is prepared to be taken from the donor. No, students, the left kidney is prepared to be taken from the donor. Hope the concept is very clear. Why I am explaining this much slowly with clear concept? Because in the last three Norcet exams, there is questions which are repeatedly arising from the kidney transplantation. So because of that, this is the very important topics I have considered. And in the upcoming Norcet 6 also, there is highest chance of the coming one questions where there is, this is somewhat complicated, the topic some students will consider. So in order to make the very easy, so I'm explaining it is very clearly slowly, because the all should understand this one, and all you should get the very easily one marks, where the other can struggling to get this marks. Okay, so you people will get the this marks very easily. That is the question which is from the renal transplantation and the renal biopsy. Okay, we will discuss the renal biopsy questions in upcoming questions also. Okay, here is the question. Read the question carefully, completely. Okay, this is the question. So with the same concept which came in your, yes, very importantly, Norcet 5 mains exam, the site of kidney implantation in the recipient. Yes, no? Which of the following is the site of implantation of the new kidney in the recipient body? Okay, so as all of you know that, so this is the, consider this one as an our person's abdominal cavity. Here the retroperitoneally we are having the, yes, the two kidney, that is the right kidney and the left kidney. So some persons is having the in such a mindset that, so we will remove the this diseased kidney out, and in the same place we will keep place the, yes, our new kidney. It is not like this, students. It is like this. Okay, the very important. So consider this one as a diseased kidney. Okay, this is the diseased kidney. In the kidney where, very importantly, we will not remove this diseased kidney out. Okay, so we will keep this diseased kidney inside only, and we will implant the new kidney in our iliac fossa. The prepared one is in right iliac fossa. Okay, the prepared one is in right iliac fossa, not left. So in the image it is left. Okay, but if the examiner asking the prepared site of the kidney implantation in the new donors, means that is, and very importantly, right anterior iliac fossa. Okay, right anterior iliac fossa is a very ideal and important site of the implantation of the kidney in the person who is receiving the kidney. Very importantly, keep in your mind. Okay, so we will not remove the diseased kidney until if the kidney is having the metastatic tumor. Okay, until if the kidney is having the polycystic kidney disease. Okay, in these two situations we will remove this kidney. Okay, and we will implant the new kidney again in the right anterior iliac fossa only. Okay, and so other conditions like the chronic renal failure, other conditions like the acute kidney injury. Okay, so in these situations, if acute kidney injury which is unresolvable, so for more than 3 months, so in those conditions also, so we can implant the kidney. Okay, so very importantly, so but the preferred treatment is in AK is the not a kidney transplantation. In the only CRF or in the CKD, it's the preferred choice of treatment is the or kidney transplantation. Hope the concept is very clear. The question is asking like this. Yes, which of the following is the site of implantation of the new kidney in recipient body? Option A is the left anterior iliac fossa. Option B is the right anterior iliac fossa. Option C is the right side flank area, left side flank area. So always first, if the question, if you get any flank area questions, just try to eliminate those questions. So your answer always should be right sided anterior iliac fossa is the best site of implantation of the kidney which we are taking from the donor and putting in the recipient. Hope the concept is very clear. This question I am giving the, yes, the 5 star for these questions. for upcoming all kind of the ESSC, Norcet, and all your military nursing services, all exams, there is highest chance of asking these questions. So hope the concept is very clear. Here is the next question. Try to answer for this question. Yes. Very easy question and very basic questions. The questions which require the solid topic and the solid concept. So once you are reading, once you are listening the class in the very easy understandable manner, so you will never ever forget this one. Okay. So which of the following needs immediate attention after the bladder biopsy? Yes, students. If in case of the any cancer of the bladder, or if in case of the any painless hematuria, if the patient is experiencing, which indicating the classical sign or the future of the kidney tumor. Okay, at that situation, in order to confirm, yes, the what we call the kidney cancer, the bladder cancer. So we need to take the biopsy from our bladder, so which is very very important. So after taking the biopsy, which of the following given option requires the immediate attention after the bladder biopsy? Yes, try to answer for this question. I am waiting for your answer in the comment box. Yes, the option is the pink tinged or tea colored urine. Option A. Option B is the increased frequency. Option C is the burning micturition. Option D is the bright red color urine. So read the question till the end. Don't put the option A as the correct answer. Students, I am giving that. So I'm sorry, removing your confusion. This is the normal. Okay, this is the normal where we doesn't require the immediate attention. So now your confusion is out, I think. So try to answer for the question. Yes, yes, yes. Who all are giving option D as the correct answer? Your answer is very very correct, students. So why? Because we are taking the biopsy, means we are breaking the mucosa integrity of the our blood, where somewhat clot or the somewhat pink colored urine is accepted due to the minor bleeding inside the bladder. Okay, the urine will come, that is in first 24 to 36 hours. So for first 26 to 48 hours, where there is a pink tinged or the tea color urine is the normal after bladder biopsy, and the person may feel the increased frequency also, and while urinating the clot will irritate the urethra, so there is a burning micturition also there. If in case of the bright red color urine, that indicating the is the massive bleeding from the our bladder, so that needs the immediate attention. So who all are given the option D as the correct answer? Your answers are very very correct, students. Where the pink tinge colored urine and the burning micturition, and yes, very very importantly, increased urine frequency, all are the normally we will accept in the patient who is undergone the bladder biopsy. Okay, hope the concept is very very clear. And what are the other things we will experience as a normal after the bladder biopsy? Students, as I told while discussing the position for the our renal biopsy, so as I told, at that situation, the position which is given for the is taking the sample for the our bladder biopsy is the lithotomy position. So it is somewhat time requiring procedure, students, as we are keeping the person in the lithotomy position like this for an somewhat 30 to 20 minutes. So the person may feel the leg cramps. So the leg cramps also normal after the procedure of the renal our so-called bladder biopsy. Very very importantly, keep in your mind, pink tinged tea colored urine, increased frequency, burning micturition, and the leg cramps after the our sample which is taken from the or the biopsy which is taken from the bladder is a normal, where the bright red color urine indicating the active bleeding from the bladder, where it is near the active attention or the immediate attention, where we need to inform the primary healthcare provider. Students, as very importantly, you have to know one more thing here. So the most common type of the bladder cancer. Who will tell the most common type of the bladder cancer? Can anyone comment? Yes, I will give the option. Yes, the epithelial cell cancer, transitional cell cancer, yes, the mucoid cell cancer, and the chondrocytoma. Yes, yes, comment plus, comment fast, student, comment fast. Yes, listen here. Students, one more questions very importantly repeatedly comes in your exam because it is very special. Okay, listen. So in condition where we are having the some column, some cuboidal cells, Okay, some cuboidal cells we are having, and over the cuboidal cells, over the, this is a simple one line is there, means cuboid cells, that is the simplified cuboidal epithelium. If it is two lines is there, means it is then two layers, we call that is in the stratified cuboidal epithelium. Okay, over the cuboid cells, where we are having the our very very important, yes, the, yes, we are having the our on the cuboid cells, stratified cuboid cells, two layer of this cuboid cells, we are having our, yes, very very importantly, which one, yes, the comment the type of the cells where it is looks like this in this structure, yes, which is this one, so you can comment. And so if it is same, it is in the two layers, what we call this one, and if it is keratinized, what we call this one, yes, can anyone comment? If it is single layer, this one only we call that is in the simple squamous epithelium. And if it is two layer of the squamous cells, we call that is in the, yes, the stratified squamous epithelium. And over this one, it is keratinization is done, means we call that is and the keratinized stratified epithelium. Okay, so over this one, very very importantly here, so we are having the again stratified squamous epithelium. Okay, on the stratified squamous epithelium, we are having the columnar cells also, like this. Okay, like this, columnar cells also we are having, and on the columnar cells we are having the umbrella like cells. So these all things, where the mix of the all things, which is the cells, we call this is and the transitional epithelium. The transitional epithelium, the epithelium only and only we will found in the renal system. Why? Because it will not allows to any fluid to leak through it. So because of that, it will start from the our renal pelvis and till until the our urethra. Okay, until the our urethra, where the urine will get out of the body. So where there is and the pipe like system. Okay, the bladder, that is the storage system, and from the bladder we are having the, yes, urethra. So anyway, nowhere in the body the urine will get leaks. So nowhere in the body the urine will get leaks because of this transitional epithelium. Very very important, keep in your mind, the transitional epithelium is the epithelium only and only we will found in the renal system of the our body. Okay, this is special, because of that the examiner may ask the question, so in which organ system of the body where we will finding the transitional epithelium, that is from in the only our renal system. Okay, so the abundant cells in the renal systems are the transitional epithelium. The most common type of the cancer where we are finding in the renal system is the transitional cell cancer. Okay, very very importantly, keep in your mind, these questions may arise in your exams. So I have built the concept that is very very important, and the questions the examiner may ask you like this. We will found all type of the cells along with the umbrella like superficial cells. Again we will put the answer as a transitional epithelium in the renal system is your correct answer. Okay, hope the concept is very very clear for this one. The most common type of the our bladder cancer is the very very importantly our transitional epithelial cancer. Okay, hope the concept is very very much clear for you all. Okay, and so the answer for the question is very clear. Here is the next question. Yes, which of the following indicates the bleeding in the post-procedure renal biopsy procedure? Okay, so what happening here? Which of the following indicates the bleeding in the post-procedure renal biopsy procedure? Okay, so what we did, the procedure we did for the taking the biopsy from the kidney. So after taking the procedure, as all of you know that for the kidney from the aorta per minute 1300 ml per minute it will get supply. So when we prick that organ where it is getting the, yes, the 22% of the cardiac output per minute, so the organ may bleed a lot. So the most common complication of renal biopsy is the, yes, the internal bleeding. Very very importantly, we need to monitor as a nursing officer for the sign symptom of the bleeding. If we need to monitor means as a nursing officers of the EMS, so we need to know that what are the early signs, what are the signs and symptoms which indicating that is the some bleeding is happening inside the body. So we need to know that one. So because of that, the you have to know, you have the clear concept. So in order to yes having the assessment abilities. Okay, so which of the following indicating the bleeding in the post procedure renal biopsy? Okay, the yes, if it is there is internal bleeding, okay, the circulatory volume will decrease. The circulatory volume is decreased means our heart is the organ which compensates by increasing the heart rate in order to pump the blood to the vital organs. Okay, if the circulatory volume is decreasing means the hypovolemia, the early sign of the hypovolemia, the early sign of the hypovolemic shock, the early sign of the hypovolemia, the early sign of the circulating deficiency, that is our tachycardia, where due to the bleeding the early sign we will get the tachycardia. Yes, that is the correct. And if it is internal bleeding is there means the circulatory volume will get decreases, again we will found the hypotension. And very importantly, something which is getting leaked out of the blood circulation means along with that our RBCs will go, our plasma will go. Okay, so because of that there is decreased hemoglobin also there because the RBC is getting lost. And the RBC along with the plasma is getting lost where the cells is getting most lost more. So we call that is the decreased hematocrit also means the concentration of the blood is getting decreased. So decreased hematocrit we will find. So all these option A, option B, and option C indicating there is bleeding inside the body, that is due to the we are pricking with the needle to one vital organs where the organ which is getting the 1300 ml of the blood per minute or the 22% of the cardiac output. So that organ we are pricking with one needle means it bleeds a lot. So in order to prevent that one, after procedure we need to maintain pressure compression for the duration of the 30 minutes. And after procedure as a nursing officer we need to advise the patient to be in the bed for a duration of the 2 to 6 hours. The strict bed rest is advised to the patient with the renal biopsy in order to prevent the bleeding inside the our kidney. Very importantly, and the post procedure we will give the position supine position with yes, the rolled cloth or the pillow under the our flank area at the site where we are taken the biopsy in order to maintain the extra pressure. And in order to prevent the bleeding we will give the yes the supine position with yes the rolled cloth or pillow under the our incision area. Hope the concept is very much clear for you all. So the signs, the symptoms, the clinical pictures, the assessment pictures where we are getting during the bleeding of the yes the blood from the renal system or the bleeding of the internal bleeding. So that is the tachycardia, hypotension, and the decreased HB and the hematocrit. So the answer for this question goes to the all the above. That is the very true and correct answer. Okay, hope the concept is very much clear for this question. Yes, here is the next question in front of you all. Read the question carefully, completely, and try to answer for the question. Yes, questions are like this. Let's try to answer for the question. Post-renal biopsy instruction to the patient, including the all except. So what you will instruction as a nursing officer you need to give to the patient after the biopsy. That is the post-renal biopsy means pre means before, post means after. So post-renal biopsy instruction for the patient includes all except. So I am waiting for your answers in the live chat session. So try to answer for the question. So I am waiting for your answer. Yes. Option A is the early ambulation. Option B is the strict bed rest for the 6 hour. Option C is the encourage the fluid intake. Yes. Option D is the yes report the healthcare provider in case of the blood in urine after 24 hours. Yes. Very importantly. So what all are the post renal biopsy instruction to the patient? You have to as a nursing officer you need to give in the patient. Yes, one we will not give all things we will give. You have to identify that one here. Why? Because the question is asked here as an except. Okay, so which one is we will not give, and what are the all three others we will give. Okay, so the option A is the early ambulation. I will keep it is in the out. So I will discuss this option in the last. And option B is the strict bed rest. So as I told as an explanation in the last question, for the patient of the renal biopsy, we will give the 6 hour, that is the 2 to 6 hour, the strict bed rest for the patient, and the serial urine. Okay, the serial urine monitoring or the serial urine catch, we can say, means when the person will void, okay, the urine, we will give the small container to the person. We will ask the patient to or person to collect the urine, okay, in each session of his voiding. Why? Because we need to assess whether there is any active clot, whether there is any microscopic bleeding inside the urine. So that is what we call the serial urine collection or the serial urine monitoring. Means for each voiding, we will collect the sample in the small box and we will see for look for the clots or the visible blood inside the urine. Okay, so that is what we call the serial urine monitoring. And we will encourage the patient for the increased urine output. So we will encourage the patient for the taking the increased fluid orally, where he can take the fluid and where his kidney functions establish easily. Okay, and option C is the report the healthcare provider if in case of blood in urine after 24 hours. Yes, first 24 hours some blood in the urine, some clot in the urine is unacceptable. Okay, after 24 hours also, if the person is getting the any active or the passive bleeding inside the renal system, so that we need to inform for the healthcare provider. So after 24 hours, we will, yes, encourage the patient. If anything blood or anything clots which will comes in the urine, you have to inform for the our primary healthcare provider. Okay, so the option A I will discuss now, students. Option A is the thing which is telling the early ambulation. Early ambulation we are doing means it will move our peritoneum and it will move our retroperitoneal organ, where there is again increased chance of the bleeding is there. So we will never ever advise the patient with the renal biopsy to do the early ambulation. What is the early ambulation? Early means as early as possible. Ambulation means the walking, students. Early ambulation means the after procedure we are encouraging the patient to walk, means no, never ever. So the condition where you will advise for the early ambulation, if the person is underwent any large incision over the lower abdomen, or the person is having the any DVT procedures, and the person is having the very importantly any implantations and all. So if the person is able to walk, if there is any contraindications and the medically indicated things which restrict the movements of the person, if there is no any restrictions, means we will always advise for the early ambulation in order to prevent the deep vein thrombosis. Students, the intervention, the perfect, the first and the best intervention to reduce the incidence of the DVT in the post operative person is the early ambulation. But students, after the renal biopsy, we will encourage for the 6 hours strict bed rest. After that only we will advise for the ambulation. Okay, early ambulation is not recommended in the renal biopsy. Keep in your mind, very important. Okay, hope the concept is clear for you all. So the accepted thing for this question is that is option A. The early ambulation we will never ever encourage the patient with the renal biopsy, where the strict bed rest for the 6 hours and encouraging for the fluid, and we will advise the patient to, yes, if there is any active bleeding inside the urine and if you are finding the blood or the clot in the urine after 24 hours, the patient need to, yes, report to the hospital. And if the person is having any fever, okay, if the person is having the respiratory difficulty, then also we will advise for the patient to come and visit the doctor, because the respiratory difficulty is indicating the post procedural atelectasis, and the fever which is indicating the infection of the kidney, that is due to the inappropriate or sterile technique of the renal biopsy. Okay, hope the concept is clear for this question. We will move for the next question. Okay, so here is the next question. Okay, try to read the question carefully, completely, and try to answer for the question. Yes, which of the following is needed to monitor in a patient after the renal transplantation? What happened here? So, which of the following is a need to monitor in a patient after the renal transplantation? So, we have prepared the donor, we have prepared the recipient, we did the renal transplantation. Now, what are the things we need to monitor in the patient after the renal transplantation? The question is asking like this. So, yes, the option is the urine output. Absolutely, we will monitor for the urine output. If we are taking the kidney from the living donor, the urine output will start as soon as possible. Okay, within an hours. Okay, within an hours. If the person, if we are taking the kidney from the, as the cadaveric or the non-heartbeat donor, which require the, as the few days to week. Okay, few days to week it required. Okay, for the normal urine output. Okay, very importantly, we will assess for the urine output monitoring and rejection and graft versus host reaction. As I told you all, so consider this one as a body. Okay, this is the implanted organ, and consider this one as a body. This is an implanted organ or the transplanted organ, where very importantly, our body is forming the autoantibodies or the antibodies which are rejecting the organs, means we call this is the organ rejection. And the organ which is transplanted and present inside the body, okay, which is damaging the surrounding tissue, means we call that is in the graft versus host reaction. Hope the concept is very clear. We need to monitor for this one also, very importantly. So in first 48 hours, if we are getting the, yes, rejections, means we will call that one, what we will call that one, I will discuss in the next question. Okay, and the renal function test values, where there is an increased creatinine get come to the normal or not, increased blood urine nitrogen, increased nitrogenous, all kind of the waste will get come to the normal or not, we need to assess. And so the answer for the question goes to the all the above is the correct answer. And what are the other thing we need to assess? Yes, we need to assess whether there is an RFT value come to the normal or not. And even after renal transplantation also, for until the kidney get normally established its function, we will perform the renal dialysis. Okay, so we will perform the hemodialysis, very importantly. Okay, hope the concept is very clear. Until where we will perform the hemodialysis. Hemodialysis should be done until the normal function of the kidney get established. So very importantly, keep in your mind. Okay, hope the concept is very much clear for you. Okay, so here is the next question. Yes, read the question carefully, completely, and try to answer for the question. Yes. Which of the following special instruction is very necessary to the recipient of the kidney transplant? What all are the very important special instruction we need to give to the patient with the kidney transplantation? Yes, try to answer for the question in the comment box. I am watching your answer in the live session box. Option is the advise prolonged sitting and contact sports. Option B is the avoid infected person. Option C is no need of the immunosuppressive therapy. Option D is all the above. Yes. So who are the giving answer as all the above? Your answer is very wrong. Okay. So I will discuss the correct answer. Please listen for the rationalize. Okay. So here is the question. Yes. Like this, which of the following are the special instruction is very necessary to the recipient of the kidney transplant person? Students, here the option is telling the advice. One word, if you are reading in Gadbad, means that will destroy your answer, students. This is advice. No, we will avoid the prolonged sitting, and we will avoid the contact sports like an kabaddi, like an wrestling, like an football and all, where there is a highest chance of the direct hitting at the site of the transplantation, where there is a chance of the damaging of the vital organ of the body. So because of that, we will advise to avoid the prolonged sitting, and we will advise to avoid the contact sports. Very importantly, where here we option is telling advise. No, we will not advise. So this is not our answer. Okay, so where the exact answer is, we need to avoid this one, not advise. Okay, option D is the avoid infected person. Very importantly, yes, all of you know that. So for the person who is going the kidney transplantation, so we need to give the immunocompromised therapy along with the steroids. So if you are giving the steroids and immunocompromised therapy in order to prevent the rejection of the kidney by the body, by decreasing the autoantibodies and by decreasing our immunity, so because of that, we need to give the immunocompromised therapy. The person is immunocompromised, means we need to advise the person not to go to the area where there is a much more crowd is there. We need to advise to the person not to visit the person or the relatives or the family member where he is suffering from the active infection. Why? Because the person who received the kidney is on the immunocompromised therapy. If he exposed to someone who is having the infection, he will having the highest risk and chance of getting infection. So because of that, we as a nursing officer, we will advise the person not to visit the infected person. Hope the concept is clear. Okay, and option C is no need of the immunocompromised therapy. Very importantly, we need to advise and educate the patient before renal transplantation only. That is it is very mandatory and it is very necessary to take the immunocompromised therapy until the life ends, and the therapy of the steroids will goes to the lifelong. Okay, so we need to educate to the we need to educate to the person that immunocompromised therapy is necessary for lifelong. Okay, so here the options is telling no need, so this is also a wrong statement. Okay, so all the above, if the two things went wrong, all the above is not answer. So the answer for the question, okay, the special instruction is very necessary, that is the avoid infectious person, and advise for the not to sit prolonged and not to do the contact sports, and we need to avoid. Okay, and here is the lifelong need for the immunocompromised therapy, where the no word is destroying the answer. Okay, hope the concept is very very clear for this question. Here is the next question of you. Okay, read the question carefully completely and try to answer for the question. Yes, I'm waiting for the your answer in the live session box. Yes, try to answer for the question. Option yes, let me read the question and clarify the question you all first. Yes, the 36-year-old patient when underwent the kidney transplantation, and after 36 hour complaining of the pain, tenderness, and his BP is 150 by 90, means the person is having the pain and tenderness, along with that person is having the hypertension, and as the WBC is increased, that is this is the increased WBC. Okay, this is the increased WBC, creatinine increased WBC, creatinine also increased, WBC also increased in the blood. So this indicates the which type of the graft rejection. So students, very very importantly, you have to know the concept where there is a 36-year-old patient is underwent the kidney transplantation. So now the time is the 36 hour is completed after the procedure, and now he is complaining of the pain and tenderness, and his BP is increased. Okay, person is having the pain, tenderness, hypertension, along with that WBC is increased. Okay, along with that the suddenly creatinine is increased. Okay, so what is the, and which everything is occurring within the 36 hour only. So what kind of the this one rejection the examiner is asking? We are having the three kind of the rejection, students. So the first kind of the rejection is option A, that is the hyperacute rejection is our first kind of the rejection, and second type is acute, third is chronic. So hyperchronic, we are not having the hyperchronic, only three type of the rejection we are having: acute, hyperacute, acute, and chronic. So if the rejection, okay, if the rejection occurring within the 42 hours, okay, so within the 48 hours, so that is the hyper acute rejection. If the rejection is occurring within the 1 to 4 weeks, that is our acute rejection, and the rejection occurring after the 4 weeks, okay, from months to year, so that is the chronic. Yes, rejection. Very, very importantly, AIMS will not ask this much only the question. The AIMS will ask that questions. Yes, the very importantly, yes, that is the kidney rejection. Rejection. So the rejection, very importantly, which is occurring, yes, within the 48 hours. So that is we call as a hyperacute rejection. Okay, hyperacute rejection, and the rejection which is occurring from the 1 to 4 weeks, that is very importantly we call that one as in the acute rejection, and the rejection which is occurring from the months to years. Okay, this is occurring our chronic rejection. In case of the hyperacute rejection, we don't have any options. We need to remove the transplanted kidney. We need to remove the transplanted kidney. Okay. In the acute rejection, we need to increase the steroid. We need to increase the steroid. Okay. Very very importantly, in and plus increase the steroid plus dialysis. Okay. And in case of the our chronic rejection, same. We need to increase the steroid dose plus dialysis. Very very important. So this is the things which came in your exam. So what is the, yes, the active intervention for the hyperacute rejection, that is the removal of the, yes, the transplanted kidney, and for the acute rejection increasing the steroid dose and the dialysis, and for the chronic rejection also it is increasing the, yes, the steroid dose and the dialysis. Very very importantly, in the given question, the thing means the rejection occurring in within 36 hours, means which is occurring within 48 hours. The answer for the question the answer for the question goes to the, yes, that is the option A. That is the hyperacute rejection the person is experiencing in the given question. Hope the concept is very much clear for you all. Okay, let me go for the next question. This is the last question and the best question of the day. Okay, read the question carefully and try to answer for the question. The most common infection in transplanted person, not only in the kidney transplantation, whatever it may be in heart transplantation, it may be liver transplantation, which may be cornea transplantation, it may be in kidney transplantation. Okay, so whatever it may be, if the person having the transplantation means the most common infection at the site of the transplantation, that is the infection of the cytomegalovirus virus. Okay, hope the concept is very important and concept is very clear. The most common, yes, the infection in the transplanted patient, that is the infection from the cytomegalovirus, and the Epstein-Barr virus is an virus which is responsible for the, yes, which disease, that is the lymphoma. That is the lymphoma, that is the Hodgkin's lymphoma and non-Hodgkin's lymphoma. We will study the, yes, the causative agent for the lymphoma is the Epstein-Barr virus. And what about the pneumocystic zerovilli or the pneumocystic zerovici, also called as in the, yes, what we call the pneumocystic zerovici, also called as, yes, anyone can tell what is the another name of the pneumocystic zerovici? Yes, very importantly, there is the pneumocystic carinii. Okay, so another name of the zerovici is the pneumocystic carinii. So if the examiner is asking the common cause most common cause of the, yes, the pneumonia in HIV patient, or the most common cause for the pneumonia in HIV or the immunocompromised patient, so your answer goes to the, that is the pneumocystic zerovici or pneumocystic carinii, as a fungal pneumonia which occurs as a most common type of the pneumonia in the immunocompromised patient like HIV and the person who is on the chronic steroid conditions also. So the person may experience the pneumocystic zerovici pneumonia. Very importantly, hope the concept for the day is very clear. Okay, so the answer for this question is an, yes, that is the option B as the correct answer. That is the cytomegalovirus. And the, don't forget the pneumocystic zerovici or the pneumocystic carinii, where it is the most common infection in the person who is having the immunocompromised stage, which is causing the pneumonia. That is the pneumocystic zerovici. Hope the concept is the very clear for this today's session. So I was somewhat slow to explain for you all. Why? Because in the each and every exams, so where there is questions which are arising from the renal transplant and the renal biopsy, so I want to clear and convey all the possible questions and the what are the directions, how many of the questions may arise in our exams with the clear concept and rationale. I have tried my level best to explain you all. So if you're still having any minor doubt, don't hesitate to comment in the comment box. So I will try to answer for your questions. Okay, so we will meet in the next tomorrow's sessions at the same time 6 p.m. Okay, in the live box. Okay, so if you are new to my video, don't forget to subscribe to the channel and don't forget to press the like button. So we will meet in the tomorrow's session same time 6 p.m. Don't forget. Tab tak ke liye Jai Hind, Jai Bharat. All the best for your preparations.